Happy 4th of July. Now, if you're a healthcare worker, you know that this is the day that most people show up to the ER because of injury due to fireworks. So let's talk about burns and what you can get asked on the NCLEX. So you can categorize burns into 4 degrees. Up here I have a picture of the skin and we're going to walk through these degrees step by step. Now let's start off with first degree. Now this is a very common type of burn and most of us have probably had this burn before. It's a burn of the epidermis, which is when you look at this picture of the skin, it's that top pink layer. It's a superficial surface of the skin. Now an example is going to be a sunburn or a flash burn. Now, second degree is going to be the epidermis, which is the light pink, and part of the dermis, which is the brighter pink, okay, going into the orange. This can be caused by flame or burn scalds. It's also important to differentiate both first and second degree, not only by the layers of the skin, but second degree has blisters where first degree doesn't. Now, third degree burns can be broken up into 2 parts. So we have deep partial thickness, which is just the epidermis and the full dermis. And then we also have full thickness, which is the epidermis all the way down to the subcutaneous tissue. Now, the subcutaneous tissue is that bottom part there. And it's important to remember that there are nerves in that area. So this patient may potentially have nerve damage. So they might not have that much pain. Now remember, if your nerves are burned, then they cannot successfully send pain signals back to the brain. Now, what are some causes of third degree burns? You can have flames or burn scalds, you can have chemicals or grease exposure, or you can have prolonged exposure to a hot surface. Now let's talk about a 4th degree burn, which is the most severe burn. It's the deep, full thickness burn. It's going to burn through all the layers of the skin that we've talked about, plus it can also go into the muscle all the way to the bone. Now this burn is going to look very dark and black and it's not going to have any edema associated with it. It's typically caused by a chemical exposure. Alright, I hope you learned something from this video. Happy 4th of July and please stay safe out there.